Benefits or you're about to file for Social Security benefits this year, then you really need to watch this video. This is the first time this has happened since 1935 when Social Security Administration was begun. We're going to an appointment only system, and there's a bunch of other changes that are really going to affect your access to your benefits, the benefits you earned, that you paid for. So, I'm going to talk about that today, and I'm going to teach you all the tricks of the trade. I ran the third business Social Security office in the country. So I am going to teach you how to manipulate, work, navigate the system, however you want to put it, to make sure you get the benefits you are entitled to. This is also a live Q&A. Make sure if you have any questions, make sure you type in the chat there. I'll talk about our agenda for the day. Should take about 15 or 20 minutes. And then I'll open it up for the rest of the hour for any questions, specific questions you have. Let's make sure you're receiving everything you're eligible for. Okay, so you've heard this before. This is kind of like a Medicare Advantage type situation: deny, delay. That's kind of the intent of what's going forward. I've talked about this several times about the attempt to kind of hand over Social Security to Wall Street, privatize Social Security, and the process of that is to make Social Security the most inefficient, agency, and difficult to get into, difficult to call, difficult to get your claim adjudicated. And that's part of the intent of politicians to completely destroy customer service. So everybody just throws up their hands and say, you know what, forget about it. Just give it to whoever, Wall Street, Enron, or whatever the case may be. Okay. So they're limiting access. And again, if you're currently receiving benefits and you're like, well, I don't care, I've already got my benefits, who cares? But tax season is coming up. Overpayments, people get overpayments. Sometimes they're correct, sometimes not so much. You're going to need your 1099. You might need to change your tax situation. So there's a lot of situations, even when you're receiving monthly benefits already for years, that you may need to access Social Security. And I'm going to give you tricks to do exactly that. All right. So limited access. I'm going to go through the Social Security policy. And I know people are immediately going to say, "Hey, wait a second, Ed. What do you got? President-elect Trump's picture on." Let me take off on the thumbnail there. Well, he was president before, and he tried to reduce the Social Security budget, tried to reduce resources for the Social Security Administration. We expect him with Doge and everything to do the same thing this time. And even if he doesn't, he's going to be the president very, very soon. And we need to reach out to him and say, hey, let's improve customer service. President Biden was the president when this whole, kind of appointment only reservation system was started. So that he definitely needs to be on that thumbnail. Okay, let's get into the actual details here. All right. So deny, delay, try to keep you from your benefits, limited access. There is walk in, yeah, to go into and actually go into the office. Walk into the office is pretty much non existent. I pulled up the actual kind of internal policy here. If you go into an FO is the field office, SSCC is the Social Security Card Center. A lot of the card centers are closing down, which is a good thing. That was a complete waste of money. I closed down my card center. I was the second one in the country to close it down, but yeah, those were completely useless. Anyway, so if you need to get something done, you have to go through an appointment. You have to go through an appointment. There's pretty much no other way. However, there are certain situations that you can um, get access. Dire need situations. If you have a terminal illness, dire need situations. Sometimes, if you have like a 5-day quit notice, to where your landlord's about to kick you out, or your electricity is going to be shut off, or something like that, you need a check. Then that's definitely a dire need. But it really depends on the particular situation. So in these particular situations, you're supposed to be able to get help immediately once you go to an office. Special enumerations, those are Social Security cards, e-verify cases. If you have one of those, you kind of know what they are. Military personnel get kind of an exception there. We used to get a lot of people coming in that want to go into boot camp. I don't know why you want to go into Marine Corps boot camp. Be stupid like me, but anyway, you have to get your Social Security number in order to be shipped off to boot camp and stuff like that. So that's kind of a particular situation. Vulnerable individuals facing barriers. If you don't have internet access, homeless, whatever the case may be, congressional or public relations related. Here's a loophole that we can use to see if we can change this policy. Please reach out to your politicians, reach out to your senator and your representative and say, hey, this is BS. I paid, you paid FICA tax all of those decades in order to, number one, to get the benefits you're entitled to, and number two, to get help to get those benefits. So if you've already paid for customer service, you're just not getting it. So reach out to your senator, reach out to your representative, call the White House, go to their social media, wherever, and say, hey, what's going on? I want my money. I want access to my money. And you can also add on there, what are you doing to improve customer service? And also, what are you doing to make sure the Social Security don't have cuts going forward? Okay. Um, there's my call for action for today, if you don't mind. If you have a pending claim and you need to have to take down documents, usually the claim specialist will tell you, hey, there's a box out there, drop it off, whatever the case may be. And this last one, local management's discretion. So here's one, and this is the internal policy that the Social Security Administration tells their managers: do not turn people away for in-person service who are unable to make an appointment, or in other situations where it does not make sense, e.g. offices with light walk-in traffic. So if you go to an office and it's got very rural, or it's not very busy or something like that, I would push and say, hey, you got nobody in your lobby. I need help. I need to file for retirement. I need my Medicare, whatever the case may be. We really need to push back on this. Politicians, again, are trying to ruin customer service, and kind of destroy Social Security with death by 1,000 cuts. So if we want it to happen, then we just don't do anything. If we want it to be fixed, then we definitely need to reach out and get this fixed. All right. So um, that is the official policy on there. And so on walk-ins, and in terms of the DO, means district office. So people ask me all the time, can I go to another district office? Yes. If you don't like the office you particularly, are is in your particular zip code, that's how they essentially set up, what office you're supposed to go to is your zip code. If you don't like the office, you don't have to go to that one. And you go to another office, you call another office, and they say, hey, this is not your office. And my response is, does it say Social Security Administration on the outside of the building? Yes. Then it is my office. So it doesn't matter where it is. So maybe this is kind of a trick we can use. If your office is always busy, then call another one preferably in the same state, particularly if you have an ongoing disability type thing. Those are kind of state specific, particularly SSI as well, supplemental security income. Pick another office in the state, some rural office or something like that might be a little bit better. And this limited access is going to get even worse than it is right now. It's been bad for years. We got a 50-year low in terms of staffing. This is what the staffing looks like: 55,000 employees. And the other line going up there are the beneficiaries receiving Social Security benefits. You got steady increase of people actually receiving benefits and decrease on staff that actually can help them. So yeah, we really, really need to do something to improve the staffing at the office and get these things done. And efficiency is always a beautiful thing. They can update the computer system. I think that would help out everybody, including Social Security employees that are having to deal with some type of old systems. Some of them are new, some of them not so much. So the Social Security Fairness Act that was just passed last week, signed by President Biden, that's going to make everything even worse, because there's close to 3 million people that have to be re-adjudicated and their benefits have to be changed. There was an issue like that about 15 years ago called the SDW, Special Disability Workload, that they had to assign people, and it took them about a decade to correct that workload. Hopefully it doesn't take a decade to correct all the Fairness Act, but people, the regular viewers, know I'm not a big fan of the Social Security Fairness Act. There's unfortunately nothing fair about it for the other 97%. But anyway, I'm going to do a live Q&A towards the end of the month. So if you have an issue, if you want to challenge my belief that Social Security Fairness Act is actually unfair, then towards the end of the month, the next couple of weeks, I'll do one and let's talk about it. Let's discuss it. If you want to appear live and make your case, let's do it. All right. Why is all this happening? As I mentioned, they're trying to drown Social Security, trying to kill Social Security with the death by a thousand cuts. They're doing a phenomenal job there. And they're also trying to privatize. So I guess that, if you get less benefits, if you lose access to your benefits, then then that's more for Wall Street, perhaps, right? All right. So, and another thing is, even if you don't have a retirement, if you're going to be filing for Medicare, this is important, very important, that you, if you're about to lose your Medicare coverage from work, then if you go ahead and if you're being receiving benefits, so you're in 67 or 68 or 70 or whatever the case may be, and you're about to lose health insurance from work, and you go down there and file for Part B, to start, your Part B and start your Medicare. Some people, I'm afraid, are going to lose health insurance and be without health insurance for about a month or so, because the process goes usually about a month or two before you go down there and get everything started. But now it's, if you're lucky, if you can get an appointment in a month or two, and particularly that people that are already on benefits or decline Part B because they already had health insurance from work, if they go down there and take those two forms, the 564 and the 40B, to sign up for B after the fact, they drop it in the box or they fax it in to a system called WorkTrack, which I actually helped design. So I know that system works, but the problem is people actually have to pull the document out of the paperless system to work it. So this is going to be very, very tough. So be very, very careful. I would do it as soon as humanly possible. You can only basically do it like 3 months in advance. So I would do it exactly 3 months in advance. Submit that paperwork. That way, you know that your health insurance ends one day, and your Medicare Part A and Part B, and whatever Medicare plan you choose, pick the next day. And that's why I've got where is it? Chapter Medicare. You can reach out to them, and it can help you with all the other Medicare supplements, Medicare Advantage, Part D plans, and stuff like that. But this is going to be a critical one. I'm afraid, because of the delay and the deny of an access. A lot of people are going to be without health insurance for about a month or two, because of the delays there. So yeah, please plan accordingly. Um, if you need documents or anything like that, this is an important one. Protective filing. Now, let me jump back up to protective filing there. If you are going to be filing for anything, disability, retirement, survivor benefits, Medicare, whatever the case may be, and you call, and I'm getting reports, people waiting 3 hours, 7 hours, and then they just are hung up on. And number one, what do you do when that happens? You immediately reach out to your politician and say, "Hey, how come I was just hung up on your office, the office right down the street from your congressional office, the Social Security office? I called them. I was on hold for 3 hours. How come they're not helping me? How come they delayed my retirement? How come they delayed my Medicare? How come they delayed all this other kind of stuff?" So we need to reach out to our politicians and hold them accountable. But keep a log when you're sitting there on the phone. Hopefully you're using a cell phone. Record that date, just take a little picture of it to screenshot or something like that. And that way, a week later, a month later, when you actually are able to talk to a human being at Social Security and they set you up an appointment, if you had tried to call a month before, show them that log, show them that picture and say, "Hey, I was on the phone. I called the 800-772-1213. I was on hold for 3 hours last month. So I wanted my benefits to start last month. So because, y'all you didn't pick up the phone. I understand it's the political people that are trying to keep resources from you. So always be nice. It's not the Social Security's fault. They don't, Congress budgets them. Congress is the one that gives them resources. So let's all be nice to Social Security. They're already having a tough job, and they're losing people left and right because, everybody's frustrated. So keep that log and show them at that time, and that's called a protective filing. So even if it takes you a month or 2 months or 3 months to get in and get your actual appointment, you're not going to lose any benefits if you keep that record that you did in fact try to call them. So keep that log. And in terms of documents, do not wait for documents. Do not ever wait for documents. If you're about to file for disability, retirement, survivor benefits, spouse benefits, or something like that, don't say, "Well, I'll call them up when I get my divorce decree. I'll call them up when I get my doctor's note," or something like that. No, file first. Start the process first. That's protective filing. So it starts whenever you reach out to Social Security, you're protected for that month. So, like if you called January 31st and got in and talked to someone, and then 2 months later, you actually had your interview and you've got your claim adjudicated, you can actually start your benefits in January because you called January 31st. So, or you have a call log that you called January 31st. Okay, so never wait on the documents, just go ahead and do it. And this is the most important thing that I've talked about this a couple of times, and people said, "No, this is no problem. I just go online and I get my stuff." Well, that's beautiful for you. Congratulations, you had an easy case. Retirement, your earnings weren't messed up. You didn't have any scrambled earnings. Your date of birth on your Social Security number and everything was correct, and you were able to get into the system perfectly. Then awesome, great, awesome for you. But there's way, way too many people that wasn't the case. They're not able to get onto the new secure website. They're filing for the wrong benefits. Here's the big one: is because it's difficult to get in. When you get in, you just it's kind of wham bam, thank you, ma'am. You just get your thing and you move out. But perhaps you shouldn't have filed for retirement benefits. Maybe you should have filed for survivor benefits instead. Maybe you should have filed for disability instead. Maybe you should have filed for retirement and disability for instead. Maybe you should have filed for independently entitled divorce spouse benefits. Maybe you shouldn't have included Part B. That's the issue. And the Social Security employees, they are so underwater right now. Unfortunately, I know they're missing things, and they're the training, because they're not training enough, because they're having to put people on the phones and do interviews. So unfortunately, it's kind of buyer beware, that you have to know exactly what you want, know your options, what kind of benefits you need and when, before you even go in. And that's exactly why I'm doing this channel. So please like, share, and subscribe and all that kind of stuff, so more people get this information. This is exactly why I'm doing this channel. That way, when you go into a Social Security office, you know exactly, okay, I want my retirement, and I also want independently entitled divorce spouse benefits, and yada yada yada. And I know I need Part A, but I don't want Part B and all the rest of it. So it's important that you know what you want and what are available to you before you even go in there. Okay. So as I said, this is for new people that are turning 65 or 62 or 67 or 70 this year, filing for a new claim, your survivor benefits, or whatever the case may be. But it's also for those people out there currently receiving benefits. It's tax time, our favorite time of the year. Tax season is coming up. You're going to need your 1099. If you don't have access, remember, to get access, I would definitely get access to the internet, to mysocialsecurity.gov now. Go into ssa.gov. They just changed the system within the last few months, which is a good thing. They made it more robust, more secure, to prevent other, nefarious people from going in pretending to be you and causing you trouble. But the problem is, it makes it difficult for you to go in there and do the right thing, and get your 1099 and all that kind of stuff. So I would immediately make sure you can set up your account now, because you're going to need your 1099 to do your taxes and all the rest. And if you're looking for early retirement, to do a work report, to check your earnings, all those things, I would definitely get in there now. Everything is going to take a longer lead time to get anything done, and expect to be hung up on, to have your appointment and nobody call you back. It's a terrible situation. And again, I would argue politicians, those who want to destroy Social Security, this is exactly what their plan is. If you look at my description in YouTube, I've got their playbook. It's in the description in YouTube, and you can see that is their plan. That is the strategy. So there it is. So don't give up, because if you give up, guess what? They win. So we have to persevere and make sure Social Security is robust and they take care of customer service, the employees. I guarantee you, I've thousands and thousands of Social Security employees I know, and they want to do a good job. Yeah, there's one or two that's anyway. But most of Social Security employees want to do a good job, but they really really need your help. So please reach out to your politicians and say, hey, what are you doing to improve? Forget about the entire country, Congressman. What are you doing to improve the customer service at that office right down the street from you? Tell me what you're doing, and don't give me some BS. I'm going to do kind of a master class on political BS when it comes to Social Security. So when politicians say this, they actually mean this, and when they say this, they actually mean this. So we're going to make sure they don't distract us, and we focus on the eyes on the prize. Okay, all right. I went through that pretty quickly because we want to get to as many questions as humanly possible. Let's jump into it. If all earned income is reported to Social Security, both covered and uncovered, wouldn't this solve the problem? In 1983, this may not have been practical, but with today's technology, it's an easy fix and fair. 100%, I agree with you. That's the solution. That's what should have the Social Security Fairness Act should have been that. That's it. It should have just thrown the baby out the bathwater. It should have been that, and then everything would have been cool and copacetic. But they decided to, yeah. So anyway, but yes, you're 100% correct. My list so far: teachers, firemen, police, state, federal. Okay. All right. I'm going to stop talking about the Social Security Fairness Act. I'll do it one more time here in about a week or so. I'll give that 3% an opportunity to vent and yell at me and call me all kinds of different names. Um, uh, so I'll do that in about a week or two, and then we'll debate the actual fairness of the Social Security Fairness Act, and then I'll drop it for a while and get on to other things. So when the Social Security tax is removed by Trump and the tax funds not replaced in the trust fund, there goes Medicare. Both sides will want Social Security and the trust funds to fail. Yes, that's President Trump, soon to be President Trump, President-elect Trump, said he's going to end Social Security taxes. Perfect. I like it. Yes, they should have never taxed Social Security, but they did. And let me throw this up here. This is, you see on the top left there, payroll taxes and taxes on old age survivors and disability benefits. $49 billion comes in every year. This is 2023. We don't have 2024 numbers yet. But 2023, $49 billion came in on taxes on Social Security. So if you get rid of those, you got a $49 billion gap you need to fill. So that's one of the reasons that the estimates are that the cuts are going to happen sooner, because right now we're looking at probably about 2033 with the new Fairness Act that came in of cuts, and we're looking at probably about 22-23%. I need to update this based on President Biden's signing, but the actual numbers haven't come out yet. But if President Trump gets his things that he's been talking about, ending taxes and the rest of it, then the cuts are going to happen a lot sooner and they're going to be a lot deeper. And they won't happen during his term. People always say, Ed, he said he's not going to cut. Yes, I understand that. But if you don't solve it now, if you don't do things, then the cuts will happen not during his term, it will happen during the next term. So just saying I'm not going to cut it and I'm not going to raise the retirement age, just saying that doesn't, it helps, but it doesn't, because the cuts are going to happen. What are you going to do to actually make sure the cuts don't happen? So that's the question. All right. Let's see here. I'm turning 70 and my wife will reach her full retirement age the same month. We'll file simultaneously. Will they affect how she gets spousal benefits? No. No, not at all. Unless she's part of that Fairness Act, and then it will. But if you're not part of that one, then no. Let's see. Oh yes, please, everybody, thumbs up. This is how we get the information out there, so we can improve customer service. So, I'm 63, widow. I draw disability since 2012. My husband passed in 2020. 12. He was 55. Do I just keep drawing off him, or did they automatically put me on retirement? Okay. So you're 63 right here, receiving draw disability since 2012. Okay, so you're receiving DWIB, disabled widows benefits. So you're receiving widows benefits off of him because you were disabled between the ages of 50 and 59. So perfect. No, you just continue to receive those widow benefits unless your benefits on your own record have increased to more than those surviving spouse benefits that you're receiving, the widow benefits. So I would call Social Security and say, hey, if you can get through, and then while you're waiting, on hold, pop up your laptop and then reach out to your politicians and say, hey, how come I'm on hold for an hour and 2 hours at your office? So anyway, so you call up Social Security and say, hey, how much is the benefit on my record? And if they say it's more than yours, then you might want to think about switching over to yours. Or because you're only 63, remember your benefits are going to continue to increase all the way until you're 70 years old. So if they're not higher now, they might be next year, the year after, or 70. So just keep an eye on it, and then jump over to your own benefits in and if they get higher in yours. So all right, get some other questions. Make sure if you don't feel right about what you were being asked to speak with an OS operations supervisor. Yes, exactly. If you get an incorrect answer, you can always ask for an OS operational supervisor. Operations supervisor. Yes, perfect. Let's see here. Melissa, when I turned 60, I applied for survivor benefits for my deceased husband. I was denied benefits saying I made too much money. How much money can you make and still be eligible for benefits? This year it's $23,400. So that sounds right. You anytime you receive benefits early like that, you're subject to the annual earnings limit. So this year is $23,400. If you make over that, then Social Security holds back $1 for every $2 you go over. So, how do I get rid of a payee? Yeah, you just if it depends on what type of issue it is. If it's kind of because of a physical disability or mental disability, you get whatever primary doctor you have that addresses that issue. We've had people that had psychological issues, and they go get a note from their podiatrist and said, oh yeah, they can take up their own benefits. It kind of has to be the same type of anyway. But yeah, just get a note from the doctor or so and say, hey, they're now able to take care of their own benefits, and you can get it switched to yourself. That's one of the things that if you push hard enough, they can make you your own payee, even if they think you need a payee. We've had some interesting cases in my life, in my career at Social Security. Lady used to come in on a weekly basis and steal our toilet paper, and we tried to get her kids to be the payee, and they said no, we don't want anything. So we had to make her own payee. So yeah, um, so anyway, I got tons of stories at working at Social Security. So people giving birth in the lobby and all kinds of interesting stuff. And we gave them gave the kids a Social Security card immediately. So. How can I verify that my military service was accounted for? Yeah, most of that time is automatic. The VA and everything they contact, but you can call Social Security and just confirm it's in there. But 99% of the time it's in there, particularly if you served. In the 10, 20, 30 years ago, during the Vietnam War, there was, people that were in Korea in the Vietnam War and stuff like that. It was a little bit more difficult, but it's getting easier and easier and easier to be automatic going forward. Tom, thanks. I know medical looks at my income being taken out of my 401 tax account, but before I retire in 2023, I had a lot of money that went into the 401k post tax. Will that raise my IRMA? Yeah, your IRMA, your income related monthly adjustment amount, that's the extra Part B premium that people pay based on their income 2 years ago. Yes, and taking an allocation out of your 401k, not a Roth IRA though, but I'm not a tax type of person, so it's basically your was it category 11 and 7 of your 1040, line 7 and 11, I think it is. Um, of your 1040, it's your modified adjusted gross income, but that's more of a tax type stuff. So how you categorize that. So I would reach out to your tax accountant. I always avoid any type of tax type stuff like that. Social Security disabled my account and I cannot get back in. They say, sorry, nobody notified you. I couldn't get in. I didn't tell me anytime I had to log in back in. What do I do? Yeah, unfortunately, I'm seeing that a lot. It's good that Social Security made it a lot more difficult. I went and redid mine, and it was basically I had to set up an appointment with somebody online, and the guy was like half asleep on the other side of the camera there. And I had to hold my driver's license up to my foreheads and get real close, and so they could read it and see my face and stuff like that. And that's how they verified it. I think I did it through ID Me. So yeah, it's difficult, and you just have to work through the system, unfortunately. But it's good that they are making it more difficult to prevent people from going in there and getting things. You have to give it to Social Security in that regard. You hear these, these hospitals and chain restaurants and stores and stuff like that. Credit card companies losing millions of social security numbers and records and names and all that kind of stuff all the time. But you don't, knock on wood, you don't hear that from Social Security. So Social Security is very, very tight when it comes to stuff like that. You really don't hear about Social Security, losing stuff. You hear about other companies, private companies losing stuff all the time, which includes Social Security records, but that's not Social Security. So, oh, okay, let's see. Oh, no, because thank you, sir and team. Thank you, appreciate it. Thank you very much for the support there. Thank you, sir and team. The team is just basically me and my son. So my son will appreciate this as well. I appreciate it. And it's just me and him, and we help with all things retirement, disability, survivor benefits, Medicare Part A and Part B, and then chapter. We've recruited to help y'all with Medicare supplements and Advantage and stuff like that. And this is also the open enrollment period as well. So for if you have a Medicare Advantage and oops, I picked the wrong one, you can switch. You can switch one time. If you switch this month in January, the new one will start February. You can only do this one time during this period from January, February, March. You can actually go back to original Medicare. You can drop your Medicare Advantage plan and go back to original Medicare and get a supplement. But if you get a supplement, which are the ones I recommend, the supplement plan N or the plan G or F, if you're elderly enough, you'll depends on your state situations. You might have to go through health underwriting. So if you're healthy, I would definitely look at seeing if you can go back to original Medicare, so you avoid all the denials and delays and prior authorizations and all the rest of it. So, and then you can reach out to chapter and they can see what's available in your particular neck of the woods. Is it best to send the CDR form through certified and tracked mail to make sure the SSA gets it? You can if you want, but yeah, it's kind of cost you money, and that just means the post office, perhaps delivered it, and doesn't necessarily mean it won't get lost on the other side. Probably the best way to do it is to actually fax it in to WorkTrack, that paperless system, which I helped design. And it got in there. If you use a fax that says, that the confirmation receipt type fax, that it actually went through, and that's a good proof that you actually sent it in. Whether it's worked, whether an actual human being, an employee, pulls it out of that paperless system and actually works it in time, but yours is a CDR. You don't care if they actually work it or not, right? But people that send in Medicare, forms for, sign up for Part B and stuff like that, that's a good way of doing it. Or you can go on, do the system online. So, good morning from Australia. I was married to an American and lived in the U.S. for many years. I received Social Security spouse support. Okay. Yeah. If people, that's the big thing nowadays, people moving all over the world. If you're an American citizen, you can live in anywhere, any country in the world and collect Social Security benefits, except for North Korea and Cuba. But if you're not a U.S. citizen, if you're just a green card, it really depends on what state, or excuse me, what country you're moving to. How do I check, aside from asking you, that I'm getting an additional amount of SSDI? Do you have a link that I can look to love your channel? Oh, appreciate it. That you're getting an additional amount of SSDI. That you're getting the correct amount of SSDI is based on your earnings record. So go into ssa.gov, set up an account, and if your earnings record is correct, then your monthly benefit amount is correct. That's how they determine your benefit amount, is by your earnings record, how much you actually earned throughout your life and paid into Social Security. And that's the issue with those 3% of the Fairness Act thing, is most of their earnings are not in there regularly. So that's why they're getting those extra benefits. So where do I find all the A, B, C, D, E, et cetera, original Medicare plans, info, and costs? Yeah, the whole thing's a nightmare. I always say that if I was dictator for a day, that's the first thing I would do. Sorry, chapter, but original Medicare Part A and Part B, if I was dictator for a day, I just fill all the gaps, make it cover the prescription drugs, make it cover vision, dental, and hearing, and you would not need a Medicare supplement or Medicare Advantage or anything like that. But and my regular viewers of my channel know the first thing I would do is the cure for male pattern baldness, and then I would fix Medicare. But in the meantime, So Part A covers the hospitals. That's zero premium for most people. Part B covers your doctors, and that's this year is $185. But the problem with Part B is that there's that gap. So if you get a $100,000 band-aid from your doctor, you have to cough up $20,000 cash because there's a 20% coinsurance. That's why people get either a Medicare supplement plan or a Medicare Advantage plan. Always, always, always check to see if a Medicare supplement plan is the best for you first, a plan N or a plan G. And if it's not right for you, then start looking into a Medicare Advantage plan. And then the D is just the prescription drug plans. So again, you can reach out to Chapter, and they 100% free, and they can look and see what's available in your area and talk to you about the differences between a plan N and a plan G and a Medicare Advantage and all the rest of it. So, what are the facilities or conditions that would be easier to prevent a 55-year-old man suffering from hernia? Yeah, I have no idea. Not that type of doctor. I applied for SSDI in March 2024, 58 years old, and they just asked me a few days ago for the work history report. Is there a reason why they didn't request a function report? No, it's just sometimes, yeah, I don't know why they do that. During the actual interview at Social Security, they ask you all those questions, and then it seems like a week later or something, or 2 weeks later, the state agency, the DDS, they send you kind of the same type of thing. I'm not sure why they do that, but just fill it out and return it. 120-minute wait. Well, that's actually pretty good from what everybody else has been saying. Yeah, so that's still terrible if you ask me. When I ran my office, we had to answer 97% of the phones within like 3 minutes or something like that, and we always did a phenomenal job on that. But the problem with Social Security offices is get kind of a whack-a-mole. People ask me, "What's a whack-a-mole?" I'm dating myself. It's where you get that little baton and you whack the mole, the little game that little pops up. Um, but it's like, okay, hey, put more appointments on the calendar. Okay, we've made more appointments, but that takes away the phones. And it's like, okay, answer more phones. Oh, okay, we'll answer more phones. Take care of more people at the lobby. Okay, we'll take more care of more people at the lobby. You know, clear your caseload quicker. Okay. So it's like, okay, you take one for this, and it just, yeah, it never ends. And now I can even imagine how terrible it is right now. So let's, yeah, please be compassionate and say, hey, I'm just wondering what's going on with my retirement claim, my disability claim. I really need help on this. I want to make sure I'm getting the right benefits. I understand you're not getting support from your politicians. I just called before I called you. I called my politician. I told them to support you, just kind of FYI. And I'm sure the person would be very, very happy. They probably can't say they're not supposed to be political like that. That's why I'm kind of advocating for them, I guess. I'm getting Social Security, and my husband is on disability, and I am at retirement age. If I retire, would his benefits be cut? No, your retirement benefits have zero effect on his disability. I assume he's just getting regular Social Security disability insurance and not the SSI. If he's getting SSI, the welfare based program, then there might be an effect there. But if he's getting regular Social Security benefits, then no, absolutely not. Make sure, double check to see if you're any spouse benefits available that he might be able to get benefits on yours, or you might be able to get benefits on his. So definitely check that out. I applied for my own benefits, and they are wanting me to withdraw and get survivor benefits. Do I have to do that when I feel survivor will be more when I am 67? Spouse died at 61, never claimed. Yeah, sometimes they like to do that. I'm not sure why, but you just tell them you can file for either one and say, yes, I understand the benefits are more on my record or that record or whatever the case may be, but I want to file on the lower benefit now to have the other benefit increase. And if they don't let you, then maybe it's time for you to reach out to your politician and say, hey, what's going on here? So 120 minutes wait on the phone to answer a question. Shameful. Yes, 100%. So hopefully while you're waiting the 120 minutes, you reach out to your politician. Hi, I was a state employee in Nevada for a number of years in the 1990s. I opted for a 403B, not the state pension system. Will I be impacted by the WEP changes? No, on that particular system, probably not, because you're not getting that non-covered pension, and your earnings were all covered in there theoretically. So, yep, you should be good. But I would definitely reach out and kind of double check that. Some of those, TIA, CREF, and it's all kind of complicated. Um, But since I guess the laws, been changed, then yeah, I think it's going to change. I think it's going to take a long time to get everybody's to adjudicate the Social Security Fairness Act across the board. I think it's going to take years, personally, but to get every single person. The easy ones are easy, but there's going to be leftovers. That's going to take a long time. So, widowed after 30 years, remarried before age 60. Okay, I want to back up here and say people are going to freak out. It's going to take years. If you're already on if you're already receiving benefits and you've got that WEP calculation, then it'll be easy. Yeah. If you're getting a GPO calculation you're already receiving benefits, then it's going to be easy. If you haven't filed for benefits because you filed for benefits one time and they say you're not going to get any benefits because of WEP or GPO, please, please, please call Social Security immediately, if not sooner, and set up an appointment to take that claim. And that way you're protected. So, okay, let me back up and say that. All right. Widowed after 30 years, remarried before age 60. Also, he was a veteran Air Force. I was Air Force Reserves. I don't get survivor benefits. Does being a veteran make any difference for any benefits? Nope. Veteran, in your particular case, no, not at all. There is, again, if you were in relatively recently, any type of veterans extra dollar or so has already been calculated in there, so you should be good. Couldn't get in. I called. They said, give it a few minutes and try again. I tried the next day and I was told I was disabled. Yeah. So disabled in the sense of you couldn't get into the online system. Yeah. So yeah, the whole thing is crazy. Frank, you mentioned in a recent video that some government workers will be getting extra Social Security. They hid or didn't report some income, if I understood right. How did they do that? It's all income reported. Yeah, I'm going to do a video on that. It's basically that because it's non-covered, it wasn't covered by Social Security since it's been reported since 1983. Before then, it wasn't reported. But since 1983, it has been reported, but it's reported separately. So essentially, the Social Security Fairness Act is taking advantage of a computer bureaucratic glitch to give people a higher percentage than what was intended for them. But yeah, I've done a couple of videos on that. I don't want to beat a dead horse. And I apologize for all my regular viewers that I am essentially beating a dead horse, I guess it sounds like. But so I'll do it one more time and I'll stop. I I called into the Social Security office today. I was told I did not qualify divorce spouse benefits because my ex is not drawing benefits. I am two full years disabled and 62 years old, married 13 years. Okay, 2 full years divorced. Maybe is that what you mean? I was told I did not qualify divorce spouse benefit because my ex is not drawing. Okay, that is 100% incorrect, and you know to ask that. Ask that because it sounds like you watched our channel before, and the reason you watched it is because people press like and subscribe, and that's how you got. Anyway, it's called independently entitled divorce spouse, and Social Security employees at the front window really need to be educated on this. You do not have to your ex-spouse does not have to be receiving benefits. It's called independently entitled divorce spouse benefits, and I will put up the reference one more time. Again, not one more time, but I'll do it again. So the reference, I'll type it in IEDS, and the reference is at the bottom. So take that reference there, go down to local Social Security office and say, hey, my ex does not have to be receiving benefits. It's called independently entitled divorce spouse benefits. Here's the PALMS policy. Get me my money. And if you did that like last month or something like that, then you're protected for that month. Make sure you get all of your benefits. So remember, that obviously that your benefits have to be less than their benefits and all that kind of stuff. You still need to be qualified for it, based on the calculations. But your ex-spouse does not have to be receiving benefits. So. Oh, Jack said, "I love your call to action." Thank you. Yes, please. Yeah, we really need to. All politics are local, so we need to reach out to our local politicians. Gary, I have a railroad pension coming when I turn 62 in June of 2025. If didn't file my taxes, can I still collect my pension money? Yeah. If you get a railroad pension, that's a whole different system. It's been around since before Social Security was. Yes, and so yeah, that's a whole. It sounds like a tax type of issue there. Let's see here. Who can help me get my Social Security account enabled? Yeah, the Social Security Administration, unfortunately. They're the only one. Sometimes you actually have to go down there physically and show them the ID and stuff. Well, actually, with that new system, I think that's what that new system they have, the ID Me. Instead of having to go down there, I guess they contracted with this company that has people sleeping on the other side. To be fair, I think I called like 3 or 4 o'clock in the morning, and so obviously the guy was half asleep. So anyway, but yeah, you have to reach out to them. So no in-office appointments allowed. Yeah, that's completely unsatisfactory to me. I loved in-office appointments. I love to talk to people, directly, and says, "Hey, okay, now congratulations, you're retired. What are you going to do?" Well, small little stories and stuff like that. Um, Find something to do. Here's my experience taking hundreds of thousands of retirement claims. I used to ask that kind of little small talk. What are you going to do? And some people say, I'm not going to do anything. I worked for 50 years. I'm going to sit around and do nothing. Quite often within a year, the surviving spouse came in, get it? Surviving spouse came in and filed for surviving spouse benefits. And I'm saying, wait a second, I remember this. I took this retirement claim. Yeah, he just sat around and did nothing. And yeah, you got to find something to do. Be stupid like me and start a YouTube channel. We need people with a lot of experience. We've got a lot of bunch of kids blowing stuff up and cat videos and stuff like that. That's all fine and dandy, but we need people like y'all with a lot of experience that whatever you did in life, make a channel and educate the kiddies or whoever else out there. I applied for ex-spousal benefits. Okay, let's see here. Denied because his was not twice mine. Okay, yep. So that sounds right. Is it fair that they use the amount at full retirement when I had to take it at 62? Can I receive his if he dies before me? Okay, yes, that's how they calculate the benefits to determine whether your benefits are twice his or your ex's is based on the PIA, which is the benefit amount at the full retirement age, his or hers, and then your benefit at the full retirement age. So they don't use what your check is; they use the full benefit amount number for both of you. And yes, that is correct. And good question on the end there that I should have said, because I always harass Social Security employees for not finishing the sentence. If you go in there and they say you're not entitled to benefits on your ex's record or your spouse's record because your benefit is not less than half of theirs, and then you go away, before you go away, they should, and I should have said, that all changes when that person passes away because it's no longer the 50% threshold. It goes up to 100%. So there's a lot of people out there that went into an office 5-10 years ago and they were told they can't get benefits on a spouse's record or ex-spouse's record. But since that time, that person has passed away and now the calculations are different. So now they are potentially eligible for those benefits. So those people out there that said, "Oh, I can't get benefits because of they denied me because of this, that, and the other." See if it's about the calculations, because if that person has since shuffled off their mortal coil, you just might be able to get those extra benefits. So let's see here. I'm currently working with a tax repair company for taxes unpaid for 6 years. I'm 71 years old. Can I still apply for Social Security and Medicare while I'm in the middle of the process? Yeah, yes, absolutely. And you're 71 years old. You should have applied last year. Absolutely. And but are you doing this because you're not insured? If you already have your 10 years, your 40 quarters, then yes, apply, and ask for 6 months at the very least of retroactive benefits because you should have started your benefits at 70. But if you're doing that tax stuff to make you insured, actually, I would still apply and then get all that stuff figured out, and that way you're protected. So yes, yes. Let's see. Social Security just failed to call me for a scheduled survivor benefits call again today. Come on. They didn't call November 18th. When I called to ask why, they said appointment was canceled. Yeah, this is getting just completely frustrating. And And I know the employees on the other side are just as frustrated, because they're booked up with appointments all day. And, you know, if you read the policy I just put up, it says the full policy, it says the field offices should make as many appointments available. And they're like, okay, great. Yeah, a lot of appointments. But it's like intake. You can take a lot of claim, do a lot of interviews, take a lot of retirement claims and disability claims and survivor claims and all that kind of stuff. But when do you get the time to adjudicate those? So it's a fine line between interviewing and then actually working that workload. People used to come in all the time and say, you've only got, 9 out of your 10 windows open. How come you don't have that 10th one open? I see people in the back. Yeah, they're adjudicating the claims that they, got earlier in the day or yesterday and stuff. So yeah. Reach out to your politician. Remember in the policy I showed that congressional or public relations related injuries inquiries. I guess they're financial injury, right? Yes. So reach out to your congressional representative and say, "Hey, I was stood up twice. So what's going on here? What are you doing to improve the customer service at your local office?" So yeah, this is completely unsatisfactory. Oh, somebody became a member. Thank you. Yeah, if you want to become a member, join, all that kind of stuff, I really do appreciate it. What do the government do with Social Security of people who die? Why don't the wife or husband get the money? Yeah, they do. Yep. If you are married to someone, and you get the surviving spouse benefits. Absolutely. Divorced surviving spouse benefits. Yep, absolutely. You must be you're angry about Social Security Fairness Act. You must been a FERS employee, not CSR. Yes, I'm a FERS employee. That means I paid into Social Security my entire career. So, yep. The old CSR ones, I had an office of 100 people, and there was like one person left from the old system that went away in the early 1980s. So, yep, I paid into Social Security my entire career. I get workers' comp for deceased husband. Can I apply for SSDI? Husband was not receiving security. Can I also get widow's benefits at 54 if my SSDI is approved and over 23,000? Had 3 kids. Okay, you get workers' comp for workers' comp. Okay, that's a separate issue. Can you apply for SSDI? Um, you can, yeah, possibly. It's called a DWIB. You're 54 years old, so it's called a disabled widows benefits. I would definitely call up and specifically ask for that. Say, hey, I'm 54 years old. I was married. Person passed away. I want to file for DWIB, DWB, disabled widows benefits. And if you're approved, if you got 3 kids already, with that individual that passed away, those 3 children should already be receiving benefits from their deceased parent. Um, but so that should already been done. Um, and then if you're denied for the disability, for the DWIB, because you have children and you mentioned youngest is 16. Well, the youngest is 16. You wouldn't be eligible for the child and care benefits because one of the children had to be under the age of 16. But it depends on what their date of birth is and everything. But anyway, or if any of those children have become disabled before the age of 22, then you can get those child and care benefits. So check out those 2 things. Check out DWIB benefits, DWB, and then the surviving child and care benefits to see if you're eligible for either one of those programs. Okay, let's see how are we doing on time. Let me jump down to chapter are amazing, Deborah. They work hard to assist you and get you the best deal. Love them. You can trust them. Oh, okay. Thank you very much. I appreciate it. Yeah, I've gotten really, really good reviews on chapter. So yeah, I'm going to keep them around as long as they do a good job. And they've been doing an awesome job so far, even with the challenging this annual enrollment period that just ended December 7th. Oh, that was crazy. There's so many changes. The Inflation Reduction Act that was passed by President Biden, it's going to, that was lowered insulin prices by $35. It helps with drug prices. I think they're talking about getting rid of that. So there's going to be some craziness happen perhaps this year as well. So I already had one with chapter amazing. Oh, okay. Awesome. 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 All right. Let me get to Gretchen. I got approved for SSDI at the end of July, but I'm still waiting on my back pay. I have called Social Security, but all they could do was send a message to the payment center. What should I do? Guess what? You should reach out to your politician, make it a congressional, and say, hey, July, that was like last year. Yeah, it shouldn't take them that long to process a back pay like that. And often, it's pending at the payment center is kind of a default for, they're true. It is accurate. Those sometimes they are adjudicated in the local district office, but the more complex one, if you have a lawyer and different stuff, then it is done by the processing center. So yeah, it needs to be streamlined so it's all done locally, but the local staff does just yeah. Anyway, so yeah, if Elon Musk and they want to Doge, I can definitely save some money, make some more efficient. But yeah, efficiency is always a beautiful thing. Everything lines up for me, but I never received my Medicare card number. So off I go in the office on Monday. Yes. Yeah. If you actually filed for Medicare, and you just didn't get the card or something like that, maybe they typed it in wrong. You can reach out to Chapter. They have access to a kind of an internal database that connects with Medicare. So you can give them their information, and they might be able to find your Medicare number and look at your address and say, "Oh, it looks like somebody transposed the number. It should be 1415, but they typed in 1514, so your Medicare card went to, you know, Guantanamo Bay, Cuba, or something like that." So or you can go into the office. But ooh, yeah, let us know how that goes. Okay, my late husband and I were married 7 weeks short of the 9 months when he passed. I just got approved for the hearing. Should I do it in person or online? Does it matter? It doesn't really matter for the hearing. Yeah, so there are exceptions to the 9 month rule if it was an accident or he was a a member of the military. So I did have an in-person appointment. She couldn't find my ex-spouse's social security number. That's just a bad employee. Luckily, I somehow suddenly remembered it. It's better to bring it for the next appointment. Yes. I've never, never, never not been able to find a social security number. If you have the person's name, their date of birth, as close as you know it, I've found, James Smith that was born sometime in their mid 60s and somewhere in North Texas. I was able to find social security number with that small amount of information. So yeah, the person must not have been anyway. So it's a good thing you found it though. The Social Security rep that took my over the phone appointment for SSDI was rude and impatient, not taking all my info regarding my disabilities. How can I get a copy of the report she took from me? Yeah, so, you gotta. They only have like an hour, sometimes 45 minutes to do the disability claim, and they just put, do you have diabetes? Yes, I have diabetes, and they um, you know, don't need to go into more of the details about, okay, how many, insulin do you take and, what is the result of that? It's just diabetes. And then they send it up to the DDS. And those are the people that do the medical type stuff. So yeah, unfortunately, the Social Security employees, because they're limited time and they have to get to their next 20 appointments that day, yeah, it's unfortunate, but yeah, don't worry about that. Once it goes up to the DDS, then those are the people that you can write up all the stuff that you really wanted to say during the interview. Write it all up and send it to the Disability Determination Service, the state agency. So it depends on when you took the disability claim. Maybe it's already up there. So I would find the phone number to the DDS and say, "Hey, who's the disability examiner? Who's assigned my case?" And then you find the name of the person and say, "Hey, what's a good number for me to send you what I wanted to say?" And they'll give you the number, and so you can write it up and fax it to them. So yeah, that's the best way to do it. So. I'm 67 and still working. I also start withdrawing Social Security at 60. They tax me for my money I make? Okay, that's a tax type stuff thing. So, all right, how are we doing? We got about one more minute. Let's see. Dr. Weir, you mentioned a couple times about volunteering to help out in the Social Security office through AARP. Could you repeat the information, please? Yeah, it's called AARP Senior Volunteers, and we had my office, we had more senior volunteers than all 1,500 offices combined because I loved providing good customer service. And it's like, you're going to come in and volunteer and you're going to help us improve customer service. I was like, hey, all day long. It was actually at a relative of Barry White that came in. But anyway, hey, relative Barry White, you know who you are. Didn't have the voice though. But anyway, um, yeah, you just reach out to the AARP senior volunteer and you say, hey, I want to be a senior volunteer. And they might put you at an EPA or an FBI office or the Social Security office. And if Social Security office says they don't do it, then I would reach out to your congressperson and say, hey, these offices are, these officers are underwater and, they need help and I'm willing to go help. Usually what it is the district manager of the office, the Social Security office is just too lazy. That's what I found. They were just too lazy to, do the paperwork. It takes a bunch of paperwork to do. It's government. So, but, hey, that's their job is to do paperwork. So, um, Stuart, I live in Japan. I decided to pay for Medicare Part B and set up Easy Pay with my American checking account. Why does Medicare keep sending me letters that they are taking $185? That's a waste. Um, um, yeah, I'm not sure. Is that possibly that they are just kind of notifying you that they're going to be pulling money out of the Easy Pay or something like that? So, yeah, I'm not exactly sure. Yeah, but Ohio gozaimasu. Akameshite omadetou gozaimasu. Anyway, can I change my mind not to take a Medicap Plan D plan, but sign, but didn't pay for it yet? The price is just too high. Can I get out of the contract? A Medigap Plan D. So that's the prescription drug plan. You can, if you want, but remember, if you don't get a Medicare Part D plan when you're supposed to, and then you sign up for it later, you're penalized for the rest of your life. 1% for every month you did not have your Part D plan. Yeah, unfortunately, yeah, and right now through the OEP, there is no way to get out of the Part D plan if you have a Medigap. Um, yeah, and there's no way really to change unless you've got some special enrollment period type of situation. So that might be tough. So I would reach out to whoever helped you out with that and see what they can do to help you out. So, all right, we are over an hour, and I've still got tons of questions as usual. And I apologize, we're just running out of time. Let me jump in and pop one here. Let's see. I started receiving Social Security at 62. At age 66, started working for the state for 10 years. Oh, okay. Since age 62, my Social Security has remained about the same except for the COLA increase. Would I be eligible for an increase? Yeah, it sounds like if you worked in one of those non-covered entities, then that new Fairness Act sounds like it just might apply to you. All right. All right. I think that's it for the day. We're over an hour. I apologize. I will be back again tomorrow and hopefully I get to Barry White. Awesome. Yes. Yeah. He's awesome. So anyway. All right. Y'all have a